As the scripture says, the kingdom of God now suffereth violence, and only the violent can take it by force. That is the case with certificate of sponsorship in the UK as of now. It is pretty difficult to get a job as a care assistant with sponsorship involved. However, I can boldly tell you that one of my family friends last week just got her certificate of sponsorship, that's from the NHS. So I am happy to tell you in this video that amidst the scarcity of sponsorship in the UK, especially for care assistants, there is still hope. And the hope mainly lies with the NHS. And that is why I have been making lots of videos about getting a job with the NHS. So this video is for you if you are still looking for a job to sponsor your stay in the UK. Maybe you're still a student and your dependent is still looking for a job, or you want to switch your sponsor, your sponsor in the UK, and you're looking for how to get into the NHS. One of the biggest challenge of getting to the NHS is the interview. A lot of people have gone for several interviews, but it's always unfortunately. And luckily, one of my friends has been working with the NHS and also went for an interview with another trust recently. All these NHS people, they don't want to share information because of their contract or whatsoever. So she was happy enough to share the interview questions with me. And I will tell you something. NHS interviews are fast changing. A lot of things are fast changing. Ordinarily, you would have believed that, okay, since this my friend has been in the UK for a while and she's been with the NHS, if I were my friend, I would have just been like, what sort of questions can they ask me that would be difficult? I don't even need to prepare because I have all the answers at the tip of my fingers. Nothing can catch me unawares. No question can take me off guard. That would have been the case if it was me. But I must tell you that this, my friend, found this interview quite challenging at some point. But thankfully, she got the job. And also, I'd like to say in this video that the opportunity to get a certificate of sponsorship with the NHS, especially if you have your family and you want your family to apply for their visas with you, lies with the role of a clinical support worker, or they call them nursing assistant. So this interview she went for is for the position or for the role of a clinical support worker with the NHS. And the occupation code is different from the care assistant's occupation code. So that is one good thing about it. And in this video, I'm going to be sharing the interview questions she was asked, all the stages involved. I am happy to tell you that this interview involved about 4 stages. I've shared one of the questions, or maybe 2 of the questions, in my previous video. If you haven't seen it, please do well to check that video out. And if you are preparing for NHS interview, or you are still at the application stage, you need to see this video. Consider liking this video so that it can get to more people. And if you are going to find this video helpful at the end, please consider subscribing to this channel. So without further ado, let's go straight into the business of today. So I jotted down some things from our conversation so that I wouldn't miss out any important points. First thing, after the application, they got their mails, the invitation for interview, and it was clearly stated in the pre-interview stage that you need to bring certificate, care certificate or NBQ3 certificate. And that's why I keep saying that if you are looking for a certificate of sponsorship, especially if you're a student dependent or anything like that, you need to upskill. If you're looking to get sponsored with the NHS, try as much as possible to go enroll for NBQ3. Or if you're currently working with the NHS, try to do your care certificate. So this particular job and this particular trust requested for hard copy of either care certificate or NVQ3 that is supervised, assessed by a supervisor. So not the e-learning. When you get a care job, especially those of us with private organizations, they usually give you e-learnings to do. This particular trust did not accept anything e-learning. They wanted hard copy of either care certificate, not the Florence kind of 15 care certificates, the one with the NHS or any other one that is supervised, So if you're currently on a bank job or you have your 20-hour contract with any care organization, I will urge you to go and register for NBQ3 so that you get a supervisor from your place of work. And by the time you're done with school or whatever, by then you would have your NBQ3, and getting a job with the NHS with sponsorship would be quite easy for you. Success is preparation meeting opportunity. Now, after that stage, when people came for the interview and they were asking for the hard copy of their either care certificate or NBQ3, some of them brought e-learning, and at that point, they had to shortlist some people. Those people that didn't have those certificates were asked to go back home. You know how devastating that can be. After preparing for an interview, such as with the NHS, with the hope of getting a sponsorship, and just after you arrived the interview center, you were asked to go back because you couldn't supply a document that they requested for. That can be very heartbreaking. So make sure that you follow all of their requirements to the letters. So they didn't want any digital copy, they wanted hard copy. And that was it for those of them who had it and brought digital copy. They were just laid off. They were asked to go back home. Second stage of this interview was the one that they had to write an exam. And it was basically numeracy and literacy questions, 26 questions, and they were to answer within 30 minutes. So at this point, the trust had their cutoff mark, and those who didn't meet up to the cutoff mark were also asked to go back home. They were discharged. So I don't know much about numeracy and literacy questions, but I can tell you, I'm very sure anything you want is here on YouTube. You can check on YouTube, you understand the concept of answering these questions. And like my friend said, she said it was easy. At the third stage of this interview, applicants were grouped into 3 applicants or 2 applicants. Some were 3, some groups were 2. And they assigned to each of these groups, they assigned assessors to them. Imagine 2 applicants in a group with 3 assessors. That sounds kind of intimidating. So for my friend, they had 3 assessors and they were just 2 applicants. So they handed them some case studies that had been printed in white and black. So they gave them some copies of some case studies. My friend had 1 case study. The other person also had a different case study. And they asked them, okay, assuming that your partner is the patient, explain the procedure briefly, how you're going to attend to this patient. So for case study 1, it says that there is a 36-year-old patient who suddenly became incontinent of urine. The role is for a support worker. And, 36-year-old patient, quite independent, but all of a sudden became incontinent of urine, peed on his body. What would you do? How would you handle it? The other case study was patient A went to patient B's room and was fighting patient B for the ownership of the room. If you have worked in maybe mental health or dementia unit, you would understand this question. Just assume that a patient has gone out of his own room, maybe wandering about on the floor, on the unit, and then went to another patient's room, started dragging ownership of that room, invading patient B privacy. How would you handle such incidents? That was case study 2. So, they were asked to discuss it, and, they were asking them, how would you do it individually? Okay, they were asking this other person. Fourth stage of this interview is the demonstration stage. Like I shared 2 of those questions in my previous video where the applicants were asked to demonstrate something about infection control. The second part of this demonstration was where they were given a sheet of paper that contained some instructions, some procedures for them to follow. So it was about thickening a fluid. This first step says take about 1 teaspoon of the thickener and put in an empty cup. And then the next step says add water up to half of the cup. Mind you, the cup was not calibrated, not graded in any form. So you're just to use your discretion to decide where is the half of the cup. So pour water into the thickener up to half of the cup, and then The next step of the procedure says stir it for 1 minute. And after stirring it for 1 minute, leave it to rest for 1 minute. So I believe that this demonstration was just to assess attention to details, because they said if you follow this step, you shouldn't have any lumps in the fluid. For some people, the instruction says put the water, stir for 1 minute and leave it to rest for 1 minute. But some of the applicants still held onto the cup after stirring for 1 minute. They didn't leave it to rest. They didn't put it on the table for the cup to just be on its own. They held onto the cup, and unfortunately for them, the fluid was lumpy. So even though some of them even made it up to this demonstration stage, they didn't get the job. So I would say this was to test their attention to details. So when you're going for any NHS interview, it's not just about the knowledge of care that you have in your head. A lot of things are fast changing. People used to get jobs, NHS jobs from jobs fair, but with the recent immigration laws that are changing every time, it's pretty more difficult to even get NHS jobs from jobs fair. I'm not saying it's impossible, but it's just a bit more difficult. So if your goal is to get a job with the NHS, then you should be double prepared, because it's a different ball game now, and it's different from applying to a private organization. I only wish you all the best. If you would like me to drop answers to these questions, please let me know in the comment section. Thank you for watching. If you have watched up to this point, I'd like to say a very big thank you to you, and I wish you a Merry Christmas and Happy New Year in advance. See you in my next video. Bye.